Hello everybody. We'd like to welcome you to our presentation on asthma. This was put together by Danielle Browen, Morgan Chodzicki, and Rihanna Van Erp. Asthma is a chronic respiratory disease that causes sensitivity of the breathing airways, causing them to become swollen, mucus-filled, and tight. This makes it difficult for air to pass through, which causes difficulty breathing. Symptoms mainly associated with asthma include wheezing, coughing, and chest tightness, with many other secondary symptoms occurring when an asthma attack occurs. Both genetics and environmental factors play a large role in triggering asthma, which we will talk about in the next slide. Both a combination of genetic predisposition and environmental factors can cause asthma to occur. Asthma is different than many inherited disorders because it doesn't follow typical genetic patterns. It is thought that multiple genes are involved in its transmission, which are typically inherited together on the same chromosome. Each gene can then be influenced by the environment, so the disease is considered multifactorial. It has also been shown that the level of IgE in an individual's blood can also contribute to the disease. With increased levels of IgE, the asthmatic response may be enhanced when exposed to environmental factors such as dust, animals, perfume, smoke, or air pollution. Other risk factors include smoking and alcohol, cold air, physical activity, and certain medications. Additionally, some viruses may be a risk factor, as children who experience respiratory illness due to viruses may develop chronic asthma later on.
Symptoms associated with asthma include shortness of breath, wheezing, coughing, and feelings of tightness in the chest. Often, individuals with asthma will experience short-term episodes known as asthma attacks, in which common symptoms are worsened and other symptoms are also present, including hyperventilation, increased heart rate, feelings of dizziness and confusion, and sometimes fainting.
In Canada, asthma is the third most common chronic disease, affecting around 3 million people countrywide. This means about 9.5% of Canada's population suffers from asthma. Canadian statistics show that asthma affects males more than females in childhood, but the prevalence becomes greater in females after puberty. It also shows that asthma affects younger individuals more frequently, and the amount of people affected by asthma decreases with age. The rate of asthma has remained relatively stable since 2015.
The main effects of asthma take place in the bronchioles. However, we understand on a base level that asthma causes chronic inflammation of the trachea, main bronchi, and bronchioles. These airways experience narrowing in combination with inflammation. After contact with an allergen, the smooth muscle in the bronchioles begin to spasm, and mucus secretion, vascular permeability, and immune cell production are increased. The combination of all these responses causes the bronchioles to become constricted, making breathing more difficult. More detailed pathophysiology is further explained on the next slide.
When the body detects a foreign antigen, in this case an allergen, it indicates an immune response. Dendritic cells respond to the antigen, such as dust, animals, or smoke. The dendritic cell presents the antigen to the helper T2 cell, which responds by releasing interleukins, specifically interleukins 4, 5, and 13. Interleukin 5 brings eosinophils to the area, which damages the tissue and releases cytokines and leukotrienes. Interleukin 4 stimulates B cells to come to the area as well as the production of IgE. IgE is picked up by the mast cell and is embedded within the cell membrane on the mast cell for future exposure. The next time this antigen is presented, it will bind directly to the IgE in the mast cell membrane and start the process of degranulation, which produces a variety of chemicals such as histamines, leukotrienes, and prostaglandins. These chemicals cause the blood vessels to dilate, the bronchioles to constrict, edema to occur, and mucus to fill the lungs. All right, let's summarize what we've learned so far. Asthma is best described as chronic inflammation in the lungs. Certain triggers can cause more inflammation, which leads to the smooth muscles spasming and mucus production, both of which make it very hard to breathe. Remember that it's the helper T2 cell that presented the allergen antigen from the dendritic cell that causes the production of chemicals called interleukins that stimulate the production of IgE, which attaches to the mast cell and produce chemicals that cause the blood vessels to dilate, the bronchioles to constrict, edema to occur, and a lot of mucus to fill the lungs. For our key concepts, we will start with homeostasis. The respiratory's role in homeostasis is the factor in acid-base balance. The normal range of arterial blood pH is between 7.35 and 7.45. A slight shift in this can cause either alkalosis or acidosis. The body senses these shifts in pH through chemoreceptors in the arteries. The body then uses hyperventilation in the case of alkalosis or hypoventilation in the case of acidosis to bring the body back to a normal pH range. Cell membranes are important because they display antigens for our cells to find. They also house receptors, and IEG binds to the mast cell's cell membrane for future exposure. IEGs, interleukins, receptors are all proteins that play a role in asthma.
Question 1. Fill in the blanks. Asthma can be caused by an increase in Ig blank levels in the blood. Question 1 answer. Asthma can be caused by an increase in IgE levels in the blood. Question 2. Fill in the blanks. Both a combination of blank predisposition and blank factors can cause asthma to occur in an individual. Question 2 answer. Both a combination of genetic predisposition and environmental factors can cause asthma to occur in an individual.
The increased production of eosinophil immune cells caused by asthma can become problematic to the patient over time. This is true because eosinophils release chemicals which cause tissue damage in response to the presence of foreign antigens. However, these chemicals also cause damage to the endothelium of the lungs, and after years, these effects become irreversible and cause permanent damages such as edema, scarring, and fibrous buildup within the lungs. This can permanently reduce the diameter of the bronchioles and other airways. Asthma is considered to be a type of obstructive pulmonary disease. This is true because the immune response that occurs with asthma causes the airways to become constricted and obstructed by smooth muscle spasms and increased mucus secretion.